Hello everyone, welcome to the Faraz Focus Regional Anesthesia series. I am Dr. Gopal Krishan Jalwal. In this video, I am going to demonstrate that how you can perform the ultrasound guided erector spinae block. So, erector spinae plane block is a facial plane block and it can be performed from the cervical to the lumbar region for the various indication, but the most common indication are thoracic surgery or rib fracture, brace surgery, laparoscopic cholecystectomy, etc. To perform the ESP block, patient can be placed in supine, lateral or prone position. But if you are going to perform the ESP block in lateral position, I will advise you choose the out of plane technique. So the probe you can choose either high frequency linear or low frequency curvilinear probe. At the thoracic level, preferably choose the high frequency linear probe, or at the lumbar region you can choose the low frequency curvilinear probe. The drug most commonly local anesthetic, we give the bupivacaine 0.25%, levobupivacaine 0.25%, and ropivacaine 0.25%, especially in the analgesic dose. So, and the drug volume we give the 20 to 30 ml. If we are going to perform the ESP block on bilateral side, then we have to calculate the maximum drug. The needle we use the as per patient physique, you can use either 50 mm or 100 mm. The mechanism of action is still not clear, but a few studies have shown that it blocks the dorsal rami of spinal nerves. So to perform the ESP block, first you have to feel the spinous process, and this represents the midline, and just lateral to the midline, around 5 centimeter, you have to place your probe in a parallel direction, and what you will see this sonoanatomy. Here you can see a curvilinear hyperechoic line with a caustic shadow. This represents the rib, and in between two ribs you can see a shimmering structure, that is the pleura, and just above the rib you can see the skin, subcutaneous tissue or back muscles, trapezius, rhomboid and erector spinae muscle, and this is known as a costal view. So after getting the costal view, then you have to slide your probe toward the medial side, and when you will reach at the level of the costotransverse joint, then you will see this sonoanatomy, and here you can see the step sign that represent the costotransverse joint with the acoustic shadow, and in between the two you can see the shimmering structure, that is the pleura, and here you can see skin, subcutaneous tissue, trapezius, rhomboid and erector spinae muscle. After getting the costotransverse view, then you have to move your probe further on toward the midline, and when you will reach at the level of the transverse process, you will see this sonoanatomy, and here you will see that hyperchoic line become flat, and this flat line also has the acoustic shadow, and so when you will at level of the ribs in the costal view, you will see a curvilinear round hyperchoic line, or when you will at level of the transverse process, you will see a flat hyperchoic line with the acoustic shadow. And one more thing, at transverse view you will see there will be pleura will be not visualized, and here this is a skin, subcutaneous tissue, and trapezius, rhomboid, and erector spinae muscle. So we have to deposit the drug between the transverse process and the erector spinae muscle. And so first I am drawing three lines. So first at the level of the rib, second at the level of the costo-transverse joint, and third at the level of the transverse process. So when you will place at the level of the ribs, so you will get a costal view. Here you can see ribs as a round structure with a caustic shadow, and in between you can see the pleura. So next step is you have to move your probe on the medial side, and you will see a step like sonoanatomy at the level of the costotransverse joint. Then further you move your probe on the medial side. So now you will see sonoanatomy of transverse process. Here you will see a flat line with acoustic shadow. ESP plane block can be performed either in plane technique or out of plane technique, but in this video we are performing the in plane technique, and our needle is entering from the above in the in plane of the probe. So you can see a flat hypercoic line with acoustic shadow that represents the transverse process, and you can see on the lateral side our needle is touching the transverse process. uh, Here now we will deposit the local anesthetic, and here you can see when we deposit the local anesthetic, erector spinae muscles lifting up. So this is the way in the erector spinae muscles that drugs, local anesthetics spread all over the transverse process, from one transverse process to another transverse process, and lifting up the erector spinae muscle. So here you can see that when we are depositing the local anesthetic, erector spinae muscle is lifting up and then coming back over the transverse process. So now you can visualize the needle clearly. So here I am going to deposit the 25 ml bupivacaine 0.25% in a thoracic surgery,